or that we call crepitus.
Yeah, it sounds like a Rice Krispie cracker.
Correct. And you can see over here, nothing, right? Same pressure. Now if I go over here, feel it? Okay, so over here, nothing, and I get over here, same pressure. So that's where I'm going to work.
Now, is this something that Katie can self-treat, Scott?
Sure.
Or is it something that she should have a friend?
Self-treat's hard because you get your foot up there. Now, can you do it?
Okay.
Sure. It's more effective if you get somebody just to get underneath here, bring your toes up, and really get in there. But can you do it yourself? Sure. And I've done it myself.
And this is actually an issue that you and I discussed of putting together another particular Pensivy Method tool for plantar fasciitis that might be coming out soon.
Correct. So it's a stretching tool that we're going to work together on to help. The reason why we get plantar fasciitis, which I talked about before, is you got a decrease in blood flow to the area. It's a very vast avascular area. So the more blood you can bring into the area, the faster you're going to heal. That's why it's so chronic. Plantar fasciitis is chronic. People say, "Oh, I've had it for 2-3 years." It's because it has poor blood flow. But with this technique and with the cream, it enhances the healing process. So it's going to increase blood flow to the area quicker and faster. So let me just keep working on this a little bit because it's already.
How do you feel a difference, actually?
Sure. You can just start, and I don't hear that like you said, that Rice Krispie feeling.
Scott, how long do you work on each area with the tool? Is there a
That's a good question. Yeah, it's all up to, I don't go anything over probably 5 to 7 minutes. Sometimes I can spend a minute and get it with her. As soon as I start to feel it release a little bit, I can stop. And again, the more you do it, the more time you can spend on that area. So let's say tomorrow she would come in and she was feeling pretty good. I would spend maybe a little bit, maybe double the time on that area. And I would probably start working on her calf too, because the calf comes down, attaches to the what we call the heel or calcaneus, wraps around and comes up through here. So you got to treat the gastroc and soleus area, Achilles too, and that would be my next kind of, unless you want me to treat that with her. It's up to you.
I think if you can show that area, because that's an area that I
feel that
I personally have a problem with that Evan treats me with frequently in that area.
In that area, and that's where I would look at your feet. Because of, I would treat not only that area, but I would treat your feet to get the better relief for it. So treat both areas if you could. And even you could go after your hamstrings a little bit.
I see.
You pass that.
What are you feeling, Katie, right now?
That's a really interesting point. I definitely feel an improvement. It feels like it's kind of relaxed down, that tension in the foot. But I think I just hold there probably chronically, as Scott was saying. But I think it's really interesting that you bring up that point, because I always have a problem with this calf. Not really probably appreciating that it does start at the foot and that this device can be used in both places to help alleviate the problem.
Yeah. So I'm going to have her roll over on your stomach for me. Let me work that area.
Katie, as a medical doctor, I mean, for myself personally, I had never, before meeting Scott 2.5 years ago, I'd never heard of this technique.
I think it's the principle of the technique that Scott was describing is used in massage to kind of realign the muscle, but I've never heard of any device that actually streamlines it all into being a practical management approach to actually help to treat and cure some of these chronic lingering injuries with inflammation of the tendons and the muscles. So definitely something that's really revolutionary, and actually being able to treat these chronic type of problems that can prevent further debilitation for people on a day-to-day basis. So it's really something that's state-of-the-art, and it's practical, and it seems relatively easy to use for the way it's being described.
Exactly.
After a couple applications or a couple it's almost a quick trial and error. You'll be able to figure out what's working. I could even tell when he was applying pressure to my foot, like, oh, that's definitely working.
Exactly.
You feel it
exactly.
just kind of melting away. Kind of, and you can tell she's had some problems in her calf, because I felt.
So you see this redness here, Scott?
Yeah.
Is it?
Yeah, it's alopecia. That's something that's been there chronic, something that's been there for years, and you're gonna feel it right here. Feel that right there. That's a tough spot for her. Again, I'm feeling that crepitus or that Rice Krispie feeling right in there, and I'm gonna work it. And as I go over here, I don't feel it anymore. But right in here, and you can tell me you feel it's a little sore right there.
Definitely tender.
Yeah. So.
And I would say that it's tender, but it's not painful where you're using the device. I definitely feel it working.
Yeah.
It's almost like a sore muscle feeling is how I would describe it, that there's a soreness there, but that it's alleviated pretty relatively quickly.
This is where I'll use this blade here, and I'll come down for the Achilles, tendon. It's a really good, and you can see it's just made to go for that Achilles to go right in there. It's the one I use for the fingers, and I'll just go in, and that's pretty comfortable feeling, right?
Yeah, surprisingly it is.
Just work at it, and it's not too bad, correct? It's pretty good.
No, it's actually very comfortable.
And you can see it's starting to get a little red as we increase the blood flow to that area, and the frictions cause an increased blood flow. The cells are that we call the mast cells. They help heal the tissue, so that's being worked on, and that's good. Okay.
Scott, if I was going to take up jogging,
Right.
which I don't do, but I decided I want to start running a lot, would this help to do as a preventative?
Sure. That's a
To
great.
start doing that treatment on some new sport or new activity that I would start?
That would be great for you. Yeah, you know, just to start. I mean, very rarely we do that. I see patients. Preventative, unfortunately, is we're preached at as since we were little kids, and I preach it every day to my my athletes and my patients. We just don't do it. As a population, we're pretty lazy at preventing. But this is a quick. You know, you can do it. You know, 3-4 minutes done. Go for your run. You know, and I think it's beneficial. But to teach people and have them practice prevention is probably one of the hardest things in my practice to do, and I'm sure as a physician you can agree.
Definitely relate, yeah.
Yeah.
So we went from the foot, we went from the plantar fasciitis area, worked on the calf. I know, Shaw, as a soccer player, you've got knee issues.
Yeah, let's
I
take
mean,
a look
how
at
many
your knee.
people have knee issues? And tell us a little about those.
I've had about 15 years now.
Wow.
Issues with that knee, on and off.
Okay.
So
Any surgeries or
no surgery.
just you've always had some discomfort there and
right.
Okay.
Right.
All right, let's take a look. Come on down here. Now, if he was a patient of mine, I would be doing a much more thorough exam than what I'm going to do here. But I will start off by just doing a musculoskeletal exam on him.
Okay.
So scoot down this way for me. So as a layperson, would look at this knee and say, okay, it looks like a knee to me. But what we want to do is we want to, as a layperson, maybe just touch it, make sure. Can you show me? Tell me where your soreness
It's
is.
basically along here.
It's like a
Sometimes when
strap?
when I'm standing and if I bend my knee a little bit, it feels weak.
Okay.
Like it's not gonna hold
Okay.
my weight.
Okay.
So that's why I have to always wrap it and everything before I play.
Okay. All right. And so what I would assume is that he, you know, again in the medical terms, is he probably has some chondromalacia or arthritis behind that knee. We're not going to address that per se. That's a wear and tear. It's kind of like hyaline cartilage is like Teflon on a pan, and you get a scrape in it, the egg sticks to the pan. It's kind of like that. So we're not going to address that. We're going to address the areas around it, and we're going to address this muscle. Pretty tender in here. Yeah. Okay. So again, I'm going to take the.
How long have you had these issues with the knee, and have you ever had any treatment?
No official treatment. I just wrap it.
Treat
wherever
yourself,
Yeah, right.
And I have to believe this is a common thing, Scott, with all these areas, that most people don't seek out any type of treatment at all. So, and that's why at Longevity we're so excited about the opportunity to bring Rehab 1000 and the PMT and your method and the training system, so that millions of people literally can feel relief from pain and discomfort and chronic issues. And is that what you're saying?
Yeah, I think
as
if
many
we
people
put-
as patients as you see, I would think that there are millions and millions more who just don't seek any treatment at all.
Oh, that's correct. I think if we put the body in the right environment, a lot of things can heal themselves. And that's what we're doing with this product and this technique, is we're allowing the body to heal itself by allowing it to be in the best environment to heal. And we're giving it the best chance. Now, if for some reason your pain continues to go on and on, I mean, you got to go to see a physician and get the right guidance. But strains and sprains that are simple, these aches, it's a great idea to try to see if you can treat it yourself. And again, if it's in the right environment, it's going to heal. Okay, so we're gonna, and I can tell right now, you feel that grindness. So again, you can hear that. You can hear that.
Right.
That what we call Rice Krispies. And we're going to work on that.
Traditionally, we're always told that after exercise, you ice everything. So how quickly after exercise is it advisable to use this method, because this is bringing heat?
Correct, correct. You can, there's benefits to icing it afterwards. Now, if somebody was really acute, like this is the first time I'm going to really work deep on this, I may want to ice it afterwards. It depends upon how much redness we get and how deep I'm going to go. So depending upon how you react will depend whether I'm going to have you ice for 10 minutes or so for a couple times. Sometimes I don't. Sometimes I just let the body just take care of itself. But we'll see as I treat you, okay? But that's a good question. I'm going to get in here. And I'm just going to give a little kind of twist here. And again, I'm looking for those restrictions, and I find one right here. And I'm going to use that point. You feel that right in there? Mm-hmm. Pretty aggressive. You okay? And I'm going pretty deep with him.
Scott, I'm sorry. It generally looks like you most of the time you're holding the PMT at a 45-degree angle. Is that correct?
That's correct. Yeah, you don't want to come in at it like this. That's not going to get the fibers. You got to come at it right. It's about a 45-degree angle, and you're just going back and forth, kind of painting it. And again, it's more of an art than a skill. I mean, it takes time to get used to the blade. It's kind of like somebody puts on spackle. You know, it just takes time, and you'll get used to it. And you can use it any way you want. Some people would, come at it this way. I just like it contours to the leg well. So I'll just get in here and sorry, this is gonna be a little painful.
So Scott, if we were to do this ourselves and we felt like he's feeling the pain and the grind afterwards in the knee, do you start right at the joint, or do you start up with the muscle and work down? Where do you start?
I like to start at the muscle belly, on the areas that are easier to feel. When you get down around the bone here, it's a sensitive area anyway. So I stay away from what we call periosteum.
So you work into the joint?
Yeah, I would work, go what we say proximal to distal. That's just the way I like to do it. And it's great.
So if you found a specific area that had, let's say, a knot, maybe even somewhere in the back or anything, you would kind of work from, like I said, top to bottom.
Correct.
Okay.
Yep. Yes, that's correct. And I'm going to work, and he's got a lot of tightness in his IT band, and you can see it's going to get really red here.
So this goes back to the same description you talked about, the spaghetti with the alignment of the fibers of the muscle, and you're working these alignments to the joint area, and then you're also working from the joint area back where the scar tissue is.
Correct.
So you're going from both angles out to relieve the pain.
And you can see I'm going after different angles. So not only am I going longitudinal, I'm going horizontal, almost like a star, and I'll keep on going at it. So we break up all those. That's it. And he's got a lot of scar here. You can see. You can get a little closer, you can see the alopecia here. That's a red. See how it looks like almost like a floor burn? I'm going to wipe some of that off. So
and again, that is nothing to be concerned about. That'll go away within a day or two.
Yeah, yep. And that just tells me that area needs to be treated. Okay.
So in his particular case, being a soccer player, and would this be something that he would put on before he plays or after he plays, or both situations?
Both situations. Both situations.
But from what I understand is if I put this on, I shouldn't be wrapping it.
Correct.
Or wearing any type of brace.
Correct. Although you could wrap it and it's going to get warm,
right.
It's not going to hurt you, it will just get warm. And then the more you wrap it, the warmer. Now some people like it to be warm right away, so they'll take a hot washcloth, damp it, and put it on it, and it'll activate it right away. And so they'll right away get that heat feeling. Because I'll have some patients say, I don't feel anything. Can I feel something before I leave? And so I said, sure, and I'll...
Oh, I'm feeling it.
Yeah. Yeah. Again, friction.
Right.
I'm just going to go up in here.
So now you're using the point, and then you sometimes use the curvature of the belly and the beveled edge to get into there.
Mm-hmm.
So directly on the tendons, it looks like you really focus on using that pointed part of the tool.
Yeah, and
seems easier to access. I
right.
guess.
And you can see the bone here, and I'm over the bone. I'm very careful. I've not really working hard on top of the bone because there's nothing there but skin, dermis, and you could really you want to just be careful of those areas. Patient's not or person's not going to want you to be there anyways. So I just go nice and easy over those areas. I still want to hit them a little bit because you want to increase circulation in that area. That's it.
So this increases also blood flow, and how's that important with your cream mixed together along with the PMT tool?
Well, the only way that our body heals in situations like this is a flush of good blood to bad blood. If something's swollen, there's a lot of toxins in there, and it leaves behind that exudate. So you got to get that stuff out of there. So while you're working with this tool and with the cream, it increases the circulation, opens up the blood vessels, brings in more blood to the area, and helps bring in nutrients to that area to help it heal. At the same time, it makes it more flexible. How's it feel?
Feels good.
When you stand up, just walk around, see what that feels like.
Actually, it feels a lot looser even further down.
Yeah.
Pretty good.
Do just a little squat for me, see what that feels like.
No, definitely, because usually just
You wouldn't even want to do that.
putting my one sock this way, I can't stand still like this.
So that feels better,
Yeah,
just
I
in
can
one
do it
treatment.
right now.